Most common questions that I get about the CO2 skin resurfacing category is, usually looking for a more specific breakdown on each individual emission mode. Depth of penetration, overall power output, what to expect with downtime, that kind of stuff. And also, more frequently, recently, is questions about combination treatments, which which different emission mode should you use with which combo treatment, when not to, that kind of stuff.
Hey, Matt, thanks so much for the question. Want to quickly cover each emission mode. So you've got high pulse, DEKA pulse, and smart pulse. The deal with that is that high pulse is really all about ablative technology, so that we drill a hole and don't have a lot of spread of the heat when it's all said and done. DEKA pulse, we're allowed to dial in the depth that we want to treat, and then we can also increase or decrease our dwell time based on the amount of lateral spread that we want. So more collagen stimulation with higher dwell times versus shorter dwell times and less lateral spread of the heat. And then smart pulse most closely mimics the old experience with CO2. For the most part, we end up sticking with high pulse and DEKA pulse. So in combination treatments, a lot of times we'll see it utilized with RF microneedling like Virtue. So if we want to be able to inject that heat more deeply, we can actually increase our depth with our RF microneedling like Virtue. We can increase it by 0.1 millimeters at a time, and then we can do however many passes we would need to do at the deeper depths, and then come back and do whether it's a DEKA pulse or a high pulse over the top of it to clear out the superficial dyschromia, the pigment, those types of things. So if we want something very superficial, like a 40 micron peel, we can look at something like a cool peel with high pulse at 3 watts. So lots of combination options, but the beauty of it is that we can add on any of the CO2 technologies with no consumable cost to the practice. So all of a sudden you can give a better bang for your buck, so to speak, to your patients without increased cost to the practice. So appreciate the question. Hope that helps.